Hi, welcome to my virtual presentation. I'm Dr. Kibet from the Center for Open Distance and E-Learning at Machakos University. The topic of my presentation today is gastroesophageal reflux disease. Do you usually feel like you have some burning chest pain that starts from behind your breastbone and move upwards to your neck and your throat? Or do you feel like sometimes food is coming back into your mouth and leave a bitter taste or as an acid taste? Those are signs of gastroesophageal reflux disease. What is gastroesophageal reflux disease or GERD? It is a digestive disorder that affects the ring of the muscles between your esophagus and your stomach. This ring is called the lower esophageal sphincter, or if you like it, less. If you have it, you may get heartburn or acid indigestion. The term gastroesophageal may also used to refer to the stomach and esophagus. Reflux means to flow back or return. Gastroesophageal reflux is when what's in your stomach backs up into your esophagus. Now, the images that you see here describes actually what happens. This is gastroesophageal reflux disease, which begins from the stomach. This is the gastroreflux disease, GERD, and also begins with the sphincter, which loosens on this part. What causes GERD? Perhaps that is what we need to ask ourselves. In normal digestion, your less or the sphincter opens to allow food into your stomach. Then it closes to stop food and acidic stomach juices from flowing back into your esophagus. Gastroesophageal reflux happens when the less, we talked about the sphincter, is weak or reflexes when it shouldn't. This lets the stomach contents flow up into the esophageal or the esophagus. Now, I want us to look at the things that may make acid reflux worse. If you have acid reflux disease, it will be worsened by the following. 1. Smoking, certain foods and drinks, which includes chocolate and fatty or fried foods, coffee, and alcohol. It can also be made worse by taking large meals or eating too soon before going to bed. Also, it can be made worse by certain medications such as aspirin. Now, at this juncture, I want us to look at the symptoms of gastroesophageal reflux disease. If you want to know that you have this disease, the following are its symptoms. The most common symptom is heartburn or acid indigestion, which usually feels like having a burning chest pain in the chest. Others are nausea, bad breath, trouble breathing, a hard time swallowing food, vomiting, wearing away of the tooth enamel, a lump in your throat, a lingering cough, laryngitis, asthma that comes on suddenly or get worse, and finally, the sleeping problems. Now, the next thing that we need to look at is how can we treat it? How can we treat gastroesophageal reflux disease? The following are suggestions on how to treat GERD. 1. You will take antacids These are the drugs that can help neutralize acid in the esophagus and stomach and stop heartburn. 2, we also take H2 blockers. These are the medicine that includes H2 blockers, which help block acid secretions in the stomach. Number 3, we also use proton pump inhibitors, PPIs, also known as acid bumps. These drugs block a protein needed to make stomach acid. Number 5, prokinetics. In rare cases, these drugs helps your stomach empty faster so that you don't have as much acid left in your stomach. Number 5, avoid foods and beverages that trigger GERD, such as chocolate, peppermint, fatty foods, caffeine, alcohol, citrus fruits, juices, etc., etc. Number 6, eating smaller portions at mealtime may also help control symptoms. Eating meals at least 2 to 3 hours before going to bed. Number 8, eating slowly. Take your time at every meal. 9, chew your food thoroughly. Number 10, stop smoking. Cigarette smoking weakens the sphincter. Number 11, elevate your head. Raising the head of your bed on the 6-inch blocks or sleeping lessens the reflux of stomach contents into your esophagus. 12, stay at a healthy weight. Being overweight often worsens symptoms. 13, wear loose clothes. Clothes that squeeze your waist, put pressure on your belly and the lower parts of the esophagus. And finally, I want us to look at severe cases. When you have severe cases of gastroesophageal disease, what are the recommendations? If you have severe lasting esophageal reflux, or if your symptoms don't get better with treatment, then the following procedures are recommended. 1, the first one is endoscopy. Your doctor will actually put small lighted tube with a tiny video camera at the end into your esophagus to look for inflammable or irritation of the tissues. If the results are questionable, then a small tissue or sample is removed for more testing. That one is referred to as the biopsy. Number 2, upper GI series. This is also another procedure. It's a special X-ray that shows your esophagus, stomach, and the upper part of your small intestines. The third one is esophageal manometry impedance study. This test checks for low pressure in your esophagus. It can also show defects in your esophageal muscles contract. The fourth one is the pH testing, and this is measuring the acid levels inside your esophagus through this test. It tracks how much acid is in your esophagus during the meals, during the activities, and when you go to sleep. And finally, the surgery for severe GERD. If you need regular high doses of BBIs to control your symptoms, have damage to your esophagus even with medication, and a hiatal hernia, then surgery is recommended. So that brings the end of my virtual presentation, and where we've been looking at the gastroesophageal reflux disease. Thank you and bye-bye.